Okay, here we are again. This is Personality Disorders, Part 2. These are some practice questions for you on the different personality disorders. I did cover personality disorders in a short content lecture, and I will link that down below. And also, I will link the other videos on the personality disorders that I have done so far. This is Dr. Hart. I'm Nursing with Hart, PhD. So let's get started on this one. Okay, after reviewing information about different personality disorders, a group of nursing students demonstrates understanding when they identify which characteristic is associated with schizoid personality disorder. Okay, answer choice is A, introverted, B, overly friendly, C, highly social, or D, exuberant. I gave you a couple minutes and we'll come back. Okay, let's come back to this one. So this is just a standard 4 choices, no select all that apply on this one. And the correct answer is A, introverted. So we're talking about schizoid personality disorder. These people are introverted. They are unengaged. They're not engaged, or they don't care about having friends. They don't care about having group relationships with others or any relationships with others. They are not able to enjoy joyful activities with others. They prefer to be by themselves. Reclusive, they appear distant, aloof. Apathetic, which is there's no empathy, no feelings towards others, emotionally detached. They are lifelong loners. They have difficulty making friends. They seem uninterested in social activities. They don't get any satisfaction of having personal relationships. Okay, so they are definitely not overly friendly. They are not highly social. They are the opposite. They are not social individuals. And they are definitely not exuberant, okay, because exuberant people are lively, happy, full of energy, and growing and improving themselves. That's someone who's exuberant or demonstrating exuberance. Okay, so correct answer on that one is schizoid personality disorder is definitely introverted. All right, let's look at the next one. A nurse is assessing a client diagnosed with avoidant personality disorder. Which characteristic would the nurse expect to find? And this is a select all that apply. Okay, A, shyness, B, feelings of inadequacy, C, feelings of superiority, D, perfectionism, or E, detail oriented. We'll give you a minute, we'll come back. You can pause the video. Okay, let's come back to this. Select all that apply. And the correct answers are A, shyness, and B, feelings of inadequacy. Okay, we're talking about avoidant personality disorder now. Keyword avoidant or keyword avoid. They avoid relationships with others. Very shy, timid. They fear criticism. So someone who fears criticism of others is going to just avoid being around others, and that's their solution to that problem. Feeling inferior to others, so they just avoid being with other people. Very sensitive to negative comments. Okay, another reason to avoid being around other people. And very sensitive to disapproval. They are more negative. They'll look at situations more negatively than other people would. Number or letter C, feelings of superiority. That would be a characteristic of narcissistic individuals. And obsessive compulsive personality disorder, people would exhibit perfectionism, intense involvement in details, to the point where they have a hard time making decisions and completing the tasks because they are so focused on the details. That's obsessive compulsive personality disorders. Okay, so answers on that one. A and B, shyness and inadequacy. All right, let's look at the next one. The nurse suspects that the client may be displaying characteristics of narcissistic personality disorder. Which statement by the client would help support the nurse's suspicions? Okay, so we're looking for the characteristics of narcissistic personality disorder. A, I have a very important position in life. Everyone I know wants to be like me. B, my spouse is poisoning my food to get rid of me and marry my spouse's boss. C, I like to work alone because then I can let my thoughts wander. Or D, I'm always the life of the party, making new friends all the time. All right, so we'll think about those answer choices and then we'll come back. Okay, let's come back to this one. The correct answer is A. So we're looking at characteristics of narcissistic personality disorder. Letter A, I have a very important position in life. Everyone I know wants to be like me. Okay, that's a very self-centered person, very grandiose, someone who is thinking they are above everyone else. People with narcissistic personality disorder also have a very high need for admiration. They lack empathy for others. They believe they are superior, very special, unique, and that they feel that others should recognize that these things, that they are superior, better than others. The fear of poisoning the food, that is a paranoid personality trait. Okay, paranoid personality, someone who is has a fear that someone is trying to poison their food. Working alone, that suggests the working alone suggests the schizoid personality disorder. And the letter D, I'm always the life of the party, making new friends all the time. That's the histrionic personality disorder. Someone with histrionic personality disorder, as I covered in my video, is very outgoing, attention-seeking, lots of jewelry, lots of exaggerated jewelry, clothing, spiked heels, lots of makeup, lots of heavy perfume, likes to be the life of the party, but yet underneath they have a lot of fear of rejection and a lot of self-hatred and a lot of insecurities. Okay, and so that is histrionic. Okay, I'm always the life of the party. Coming in late for a meeting, I'm here. Now the meeting can start. Making new friends, in their eyes, they're making new friends, but most of their relationships are very superficial, which means their relationships are just on the surface. They're not deep, meaningful relationships that they're making. Okay, so that's histrionic. I spoke about that in my lecture. I think I have one more here. The nurse is describing histrionic personality disorder to a group of new nurses. Which term would the nurse most likely use. So which one of these would describe histrionic personality disorder? Letter A, attention seeking, B, psychopath, C, sociopath, or D, lacking empathy. All right, I'll give you a minute and then we'll come back. Okay, let's come back. And the correct answer on this one is letter A, attention seeking. Okay, people with histrionic personality disorder can be described as attention seeking, excitable, emotional. The psychopath and sociopath, those are terms that would describe someone with antisocial personality disorder. Those are the people that are not following the rules. A lot of people in jails have antisocial personality disorders. And lacking empathy suggests the characteristic of a narcissistic personality disorder. Okay, lacking empathy, feeling superior above others. Okay, and so that's it for now, and we'll see you on the next one. Keep an eye out. There'll be more. Have a great day.